The following presentation is brought to you by the Pima County Human Resources Department and will discuss the annual open enrollment overview for plan year 2014 through 2015. The medical plan chart allows you to compare each plan side by side to see how each is designed. On this slide, we are comparing the high deductible health plan and PPO options. Both plans will cover preventative care visits at 100%, including any prescriptions that are also considered to be preventative. As you can see, each plan begins with a deductible that is the member's responsibility to meet for the first portion of health care expenses. Once this deductible has been met, each plan moves into a coinsurance realm where both the plan and the member share responsibility for medical expenses. When the member has met both the deductible and coinsurance requirements of the plan, the out-of-pocket maximum will have been met. When the out-of-pocket maximum is met, the plan begins to pay 100% of the medical costs for the remainder of that plan year. With the high deductible health plan, you will pay the actual cost of eligible services or prescriptions provided minus the approved Aetna discount. These expenses will apply to both your deductible and coinsurance until you've met your out-of-pocket maximum. Under the PPO plan, you will have a copay system set up for both your medical visits and your prescription needs. For the new plan year, your medical copays will now be applied to your out-of-pocket maximum, but not to the deductible. Prescription copays will continue to be an extra out-of-pocket cost that will not be applied to either the deductible or out-of-pocket maximum. We'll talk first about your high deductible plan option. This plan allows you to utilize a health savings account as well as take advantage of consumer tools offered via the Aetna Navigator on Aetna.com. These particular consumer tools include but are not limited to a prescription cost estimator that allows you to compare prescription costs from one pharmacy to the next, as well as to compare brand versus generic prices and retail versus mail order prices. The medical cost estimator allows you to do much of the same, but is geared towards your medical care. This tool provides information on costs related to specific medical procedures like x-rays, MRIs, and surgeries. This allows you to see what facilities provide the specific services you need, as well as what the estimate of that procedure will be at each of the facilities listed. Utilizing these tools will allow you to become a better consumer and make well-informed decisions that are best for you and your family's healthcare needs. The high deductible health plan features a deductible that allows for all eligible medical and prescription costs to be applied. Medical expenses will count towards the deductible after the Aetna discounts are calculated. The prescription costs will not have a discounted rate, but will be applied to the deductible at their actual amounts. The member is responsible for 100% of the cost of services until this deductible is met. Once the member has met the deductible, the coinsurance will begin where the plan will pay 90% of in-network expenses and the member will be responsible for 10% up to the out-of-pocket maximum. When the out-of-pocket max has been reached, the plan will pay 100% of your eligible medical expenses for the remainder of the plan year. Please note that the deductibles and out-of-pocket maximums do not cross-apply. The high deductible health plan offers a health savings account to assist you in paying for your qualified medical, dental, and vision expenses. Pima County will contribute to your HSA each payday. Employee-only coverage will receive up to $1,000 each plan year, while family coverage will receive up to $2,000 each plan year. The HSA account is owned by the employee. While Pima County will contribute funds on behalf of the employee to the HSA, the employee is responsible for managing the account funds appropriately. An HSA provides specific tax savings to the member that we'll discuss on the following slide. Please note, the 2014 annual contribution maximums include both the county and employee funds and may not exceed these amounts. There are 3 tax savings benefits provided by the health savings account. The first is the money you contribute to your HSA is done so on a pre-tax basis, thus lowering your taxable income at the end of the year. Secondly, any money you use from your HSA for qualified medical expenses is withdrawn income tax-free. And lastly, you will earn interest on the funds that are deposited into your HSA. However, this interest is not taxable income. Any amount that is unused at the end of the calendar year will be rolled over for future use. To better reflect how the high deductible plan works, we have created an example using Jackie, who has employee-only coverage. As you can see, there are 3 events in the course of the plan year for Jackie. She has her well woman visit, a specialist visit for allergies, and finally, a prescription. The table reflects the cost of each service provided to Jackie, what the plan will pay for the service, and what Jackie as the member will be responsible for paying. Here you can see that while the cost of the well woman exam is $200, the plan will cover that expense at 100% because it is considered a preventative visit. The specialist visit is $125 and the prescription cost is $47, both of which are eligible expenses but are part of Jackie's deductible that she is responsible for paying as part of the plan. The total cost of Jackie's services is $372. Of that amount, $200 is covered by the plan and Jackie's responsible for $172 towards her deductible. Remember, Jackie is participating in the high deductible plan, so the county is contributing money each pay period into her health savings account. As a result, the $172 of expenses that Jackie is responsible for can be paid for directly from her HSA. Thus, she hasn't any true out-of-pocket expenses, and the remaining balance in her HSA will roll over into the following plan year. In our second example, Daniel is also enrolled in the high deductible health plan and has family coverage. Daniel ensures that his entire family receives their annual well person exams. These exams can include physicals, mammograms, and even colonoscopies. Daniel's family is active and throughout the course of the plan year have visits to both the emergency room and urgent care facilities. There's even a trip to see a specialist. While the well person exams for the entire family are covered at 100% because they are preventative, the eligible expenses incurred at the emergency room, urgent care, and specialty office are Daniel's responsibility as part of his $4,000 family deductible. These initial expenses, totaling $1,825, are paid by Daniel and applied to his deductible. Daniel then has an inpatient surgery to repair his shoulder. This surgery's expense is $9,500. Daniel's responsible for the first $2,175 of this amount in order to meet his $4,000 family deductible. Of the remaining balance, the coinsurance begins where the plan is responsible for 90% of the expenses and he is responsible for only 10%. Daniel's responsibility of this coinsurance amount is $732.50. He also has some prescription needs as a result of the surgery, but again, Daniel has met his deductible and is sharing responsibility for his medical expenses with the plan and only pays 10% of that initial $750, amounting to only $75 for Daniel. So, the total expenses for Daniel's family in the plan year are $13,875. Of this amount, the plan is going to pay for $9,067.50, and Daniel is responsible for $4,807.50 as his deductible and coinsurance portions. Remember, Daniel is participating in the high deductible plan, so the county is contributing money each pay period into his health savings account. As a result, he can use the $2,000 county contribution into his HSA to pay for his eligible medical expenses. This would effectively reduce the amount he owes, leaving only $2,807.50 for him to pay out. The second medical plan option is the Preferred Provider Organization, or PPO. While the PPO does not offer the option to have the HSA, it does still offer members the opportunity to utilize the consumer tools via Aetna Navigator. Again, utilizing these tools will allow you to become a better consumer and make well-informed decisions that are best for you and your family's healthcare needs, regardless of the medical plan you enroll in. The PPO health plan is a copay-based plan. Medical visits and prescription needs will have predetermined copays applied to them. New this plan year, medical copays will be applied towards the out-of-pocket maximum, but not towards the deductible. However, prescription copays will remain as an additional expense that will not apply to the deductible or the out-of-pocket maximum. Preventative visits will be covered at 100% after your copay. Non-preventative services that are eligible medical expenses will be applied to your deductible. Once the member has met the deductible, coinsurance will begin, where the plan will pay 80% of in-network services and the member will be responsible for 20% up to the out-of-pocket maximum. Once the member has met the deductible and the out-of-pocket maximum, the plan will begin to pay 100% of the eligible medical expenses for the remainder of the plan year. When this occurs, the member will no longer have medical copays for their medical visits. However, prescription copays will be a constant in the plan and remain throughout the year. Please note that the deductibles and the out-of-pocket maximums do not cross-apply. The Employee Assistance Program is offered at no cost to employees, and you do not need to be enrolled in a county medical plan. Through Aetna's Resources for Living, employees and their family can take advantage of confidential counseling for up to 5 sessions per issue, regardless of whether they are personal or work-related issues that need to be discussed. The employee medical plan premiums for both the high deductible health plan and the PPO for plan year 2014-2015 have had a slight increase over the previous year. These biweekly employee premiums are before any healthy lifestyle premium discounts have been applied. The new rates will be effective July 1st, 2014 and will be deducted from your July 3rd paycheck. In order to have qualified for your healthy lifestyle premium discounts for the current open enrollment, you must have completed the requirements during the period of March 1st, 2013 through February 28th, 2014. If you have met one or more of the discount requirements, you will need to log into ADP during open enrollment and certify your discount between April 21st and May 9th. The discounts you certify during this time frame will be applied to the new fiscal year beginning July 1st, 2014. If you do not certify these discounts during the open enrollment period, you will not receive them. Remember, any discount requirements you are working towards now will be applicable in the next open enrollment period next year in 2015. There are 4 healthy lifestyle premium discounts that can be attained by employees. Be tobacco-free for at least the past 6 months. Complete the online health assessment at www.aetna.com. Complete a preventative health exam or screening each year, and earn a minimum 100 healthy lifestyle activity points. Each of the discounts is worth $5 off your biweekly medical premiums. So, if you attain all 4 discounts, you can save $520 off your medical premiums over the course of a year. The Pima County Employee Wellness website not only offers discounted rates to over 20 different local fitness companies, but an array of on-site programs and health benefits. Learn more about in-person health coaching, wellness workshops, and a healthier diet as they guide you on the path to a more balanced and healthy lifestyle. As an Aetna member, you can also receive additional savings and discounts at www.aetna.com. There have been no changes to our dental plan carriers. The Pima County Dental Plan offered through Emeritus is an indemnity plan that allows you the freedom to choose your own dentist. Once the deductibles have been met, the plan pays a percentage up to the plan's maximum benefit limit of the dentist's charges. There's a $50 deductible per person with a $150 family maximum and an increased $2,000 annual maximum benefit per person. The Employer Dental Services Plan is a dental maintenance organization with no deductible or maximum benefit limit. You must select a dentist from a predetermined list of contracted dentists in order to have services covered. This is a plan where copays apply to general services, but do not apply to specialty services. EDS specialists will give up to a 25% discount off their normal fees. The employee dental plan premiums for Pima County Dental will remain the same for plan year 2014-2015. However, employee premiums for EDS have had a slight increase over the previous year. Remember, the new rates will be effective July 1st, 2014 and will be deducted from your July 3rd paycheck. Pima County offers vision coverage through Avesis. This benefit allows for an annual eye exam for a $10 copay with an additional $10 copay for materials. In addition, this plan allows for $200 towards your purchase of frames and lenses as a package. Or you may choose to have a $130 allowance towards contact lenses, including materials and fit and follow-up exam. Avisis offers additional allowances or discounts on LASIK surgery, specialty lenses, progressive lenses, and more. Please note, you can receive a free refractive eye examination through your Aetna medical plan with one of Aetna's in-network providers. You may then utilize the Avisis benefit in order to take advantage of the lenses and frames or contact lenses allowance. The employee vision plan premiums for Avisis have had a slight increase over the previous year. Again, the new rates will be effective July 1st, 2014 and will be deducted from your July 3rd paycheck. Humana is Pima County's life and accidental death and dismemberment insurance provider. Pima County provides employees with $50,000 each of life and AD&D coverage without cost. If you are interested in enrolling in additional coverage, you can make the appropriate elections for individual life, dependent life, as well as voluntary accidental death and dismemberment for yourself or your family. When adding or increasing your coverage levels, you will be required to complete an evidence of insurability form, which can be obtained through Human Resources. Pima County partners with Arak to provide employees with an affordable and trusted legal protection partner. Arak is able to assist with legal and financial matters regarding identity theft protection, real estate matters, the creation of a will or a trust, as well as criminal and family law matters. You may also use Arak in the event you need in-office attorney services. This comprehensive coverage protects you from costly legal fees for a low premium payment each payday. Aflac offers a number of voluntary benefit plans that are specific and tailored towards the employee and their family's needs. Some important things to know about Aflac's supplemental insurances are: they pay cash benefits directly to the insured. The plans pay regardless of other insurance. If you own more than one plan, Aflac pays on all policies that apply. Rates are stable and will not increase due to age, change in health, or claims filed. No physicals are required either. Additional information on each of these plans, as well as the contact information for our Aflac agent, is available on the Employee Benefits site under the Voluntary Benefits tab. In order to certify your healthy lifestyle premium discounts and to enroll or edit your benefit elections for the new plan year, you will need to log into ADP. The link for ADP can be found on the Employee Benefit website, identified here inside the red box. Detailed information beyond what has been provided in this presentation can also be found on this site. The list of benefits, retirement plan, discounts, and wellness tabs all have additional information that may be helpful to you during your open enrollment period in order to make the best choices for both you and your family's benefit needs. After clicking the link for ADP, you will be brought to this sign-in page. Your login will be your employee ID number without any preceding letters or zeros. The company identifier is Pima County, all lowercase and all one word. If you know your password, you may enter it and select Login. If you have not logged into ADP within the last 90 days, you will be asked to recreate a new password for future use. If you do not remember your password, please select the Forgot Password option underneath the Login box. You will then be prompted to enter your employee ID and company identifier. This will generate an email to the email address you currently have listed in ADP. When you receive this email, please follow the instructions provided in order to reset and log into your account. Once this email has been sent, you will have 2 hours to take action. You only have 5 attempts to correctly enter your password. After your 5th attempt, you will be locked out of your account and will need to contact Human Resources in order to have it reset. Please remember that open enrollment is from April 21st through May 9th. This is your opportunity to review and make any benefit changes that you would like. It also is the only opportunity for you to certify your healthy lifestyle premium discounts for the upcoming plan year. The benefit changes you make and the certification of your healthy lifestyle premium discounts will be effective on July 1st, 2014 and will be seen in your July 3rd paycheck. If you have any questions or concerns about items related to benefits or the open enrollment process, please do not hesitate to contact Human Resources. Please start with your department benefit rep for any immediate assistance. If you have any additional questions or concerns, you are always welcome to email Human Resources at hrbenefits@pima.gov or call us directly at 724-8464.